In this video, we're going to cover groin pain associated with overuse injuries of muscles of the pelvis and hip. My name is Sebastian, and this is Don. We're part of locally world-famous chiropractors in Costa Mesa, California. We're going to cover some of the manual muscle testing ways that we can test these things out today and identify which muscles may be the culprit. To be fair, none of these tests are the 100% smoking gun test that tells you exactly what the problem is. It just gives you a little bit more information, but you should have more testing done. Go ahead and line your back for me. Okay, so let's put that guy down so everyone can see. All right, so the first one we should probably test is the hip flexor. Push me.
It's a little painful, but it's not my chief complaint.
Oh, so it's painful but not your chief complaint?
Yeah, it's a different spot.
How's that?
So kind of like right at that tissue hip flexor that I'm feeling right now, but my pain's usually deeper in here.
Okay, so that's good information because we can rule out Don's hip flexor as being the culprit of the overuse aspect of this problem because, I mean, if I load any tissue hard enough, at some point it's going to scream, you know. And I pulled you pretty hard, and so that means that your muscle is working well and it's not detached from the bone, and we're all pretty good.
Yep.
So maybe you got another reason for this going on. So let's keep continuing to find a little bit more information. Can you push into me?
Solid.
No pain, no weakness,
Nope.
no symptoms. So that's pretty good. So possibly then we can use this information. This lower hip angle is interesting because it really doesn't bother her. It doesn't bother you to be here, right? Did it bother you to be here when we first started?
Nope, not until we resisted.
Just resisted. Okay. So why don't we then have you push your shin into my hand? You good there?
Yeah, the longer I hold, it seems to creep up on me a little bit.
Let's do that again. Does it create your symptom?
Similar.
Similar.
Not quite it, but it's kind of like the hip flexor. It feels like the area, but not exactly it.
Okay. Where do you feel that?
It feels like it's at that hip flexor, and then it starts to kind of go deep in the joint.
Okay. So this is interesting information on this one because we actually tested the hip external rotators, right? Because you were pushing into my hand here, and so Dawn is flaring her hip out. So we're testing the hip external rotators, which are not on the front side of the hip at all. They don't even attach there. So that could mean that this possibly could be part of it because it's generating something that is not her main symptom, but it's something very suspiciously close. Okay. With the hip flexor one, like we mentioned, to go ahead and push me again, your hip flexor does go through that region and it does go towards that point. So that makes complete sense. Okay. This one is clear, so we can reasonably say the adductor group is generally pretty clear. Something else is the hamstring. We're going to go here, and I want you to actually pull me down real slow towards your heel. How you doing there?
Fine.
Good. So we can reasonably rule out the hamstring too. I had someone recently, and I'll tell you this, we did that, and she felt her quad.
Weird.
Yeah, right? It's kind of like if you were to push up against me, and we're going to test the quad now.
And I feel hamstring.
And you feel hamstring. Doesn't make any sense. And so we can maybe say those things are part of the puzzle. But at this point in time, it looks like your hip external rotators, something maybe like a piriformis or some of the small gluteal muscles may be more the culprit. So let's have you go face down and we'll check a little bit more specifically in hip extension.
Sounds good.
Roll towards me. Okay. And slide forward a little bit like you're a slug. There you go. All right. So now we're going to test on in hip extension because what we do know about the musculature of the hip is it changes slightly when the hip position changes. And so I'm going to have her pull into me. Good. And go ahead and push out into me.
It feels weak.
Feels weak?
Although it's the other hip, but it feels weak.
She's not lying with you, huh? And so she's pushing out into me again. So this is going to be internal rotation, actually. Go ahead and push into me. So that's internal rotation. And this is external rotation. How's the external rotation?
It feels okay.
Okay, that's interesting. So maybe it's not really the hip external rotators.
We'll test the one that we were testing before.
Oh, you're right. Go ahead and push in. Oh, I forgot. You're the wrong side.
Oh, that gives me my hip pain.
Okay, go push out into me.
And that feels weak.
Okay, so She has weakness of the hip external rotators and or the internal rotator is the one that hurt you. Okay. So I would say the external rotators here are probably part of the problem in regards to overuse. Go ahead and flip on your back for me. Okay. So the last thing we should do too, which is this is a whole nother ball game now. We talked about overuse injuries, but we got to figure out, is there a possibility of some type of joint issue associated with this? Because a lot of times the muscles become overused because they're trying to compensate for some type of internal physical restriction. Go and bring that down for me. And so we're going to check to see if Dawn's hip architecture is actually doing well. She has something called Dremen sign here already, so her hip is drifting out. Or I can't really feed this thing up into the socket. Does that?
There's my pain.
Yeah, that's your hip pain, isn't it? So generally, as long as I control her from drifting out where she wants to go, it recreates her exact hip pain,
Ooh.
right? And so in this case, are you doing any work?
No.
There's no muscles working, okay? So possibly what we would do with Dawn to reduce her hip overuse or the overuse musculature in the back is we need to make sure the hip joint is working well. Let's do that.
Okay.
Let's do a hip extension stretch.
Sounds great.
Okay, go kneeling. There we go. Is that your correct hip now? All right, so go and slide up in the camera just a little bit so we can see your foot in the back. Okay, so what we're gonna have Dawn do is that the confusing thing is a lot of you might, when we go through this one, is you might say, well, this is a hip flexor stretch, so I guess hip flexor is a problem. No, we don't care about the hip flexor, we care about the hip extension. And so if we can get Dawn into a lot of hip extension, her symptoms may reduce. Go ahead and walk your foot forward like if cousin It had a cousin named it Foot, then he would crawl towards me. Put your elbows on your thinker. There you go. And go ahead and can you drive your hip pocket forward? There you go. And return. Push your foot out into my hand. There you go. Drive the hip pocket forward. There you go. Just rock that guy out. So as Dawn goes through these hip extension exercises, just an important part too, if you guys have done something like the couch stretch, this would not work as well. Or sorry, that would not work as well. The reason being is because if the tissue slack of the rectus femoris goes and it takes the extension away from the hip, we're not going to get any extension of the hip. Yeah, so that's going to tension before she can get through full range. So we want full range. Go through more range. One more time. And surprisingly, after even this amount of stretches, go ahead and lay on your back, she may feel a little bit better.
I didn't even feel my hip flexor in that.
Yeah.
Which you're not supposed to, right?
Yeah, you should feel kind of maybe like the front. That feels better, actually.
I don't really feel anything.
Yeah.
Once you go deeper a little bit, but
Yeah.
definitely better.
So at some point we're going to be chasing range, which is normal. Everyone's going to feel a little bit of pinching, but that's your symptoms are reduced a lot, right?
Yeah.
There you go. So in the venture to figure out which hip muscle was overused, we found out that it was probably the gluteal muscles, but the reason is because the hip joint is not working well. What do you think about that?
I mean, it makes a lot of sense. You just realize, though, that all that he took me through, there was a lot of different things to kind of focus on, right? So you can test these things at home and see if you can come up with anything, but there's a thought process here. And although this might be something and this might be something, we see it all the time, and we can really pick individualized exercises specific to what your story is creating as we test things.
Yep. So although we can say that we can mash up the musculature of the glutes, but we really found that addressing hip extension was much more helpful in her case. Now to make it stick, we have to pick a couple more exercises, which we're not going to do in this video, but we have a lot more videos on YouTube, which you've probably seen that we've done them on hip impingement and labral tears and sports hernias and so on, but now you got to figure out which one's best for you. In that case, we can do a consultation with it and work with you if you want.
Absolutely. Virtually or in person, we'd be happy to help guide you in the right direction.
Yep. If you like this channel, please subscribe, like it, and stay tuned for the next video.